Good morning, everyone. I will start us off in this virtual session this morning. I'm really grateful to be here with you all today and have been invited to participate in the conference. My name is Rheanna Robinson. I am Métis. I'm a member of the Manitoba Métis Federation, but I've had a long history in northern BC. And I'm joining you today from the territory of the Lheidli T'enneh Nation in Prince George, British Columbia, where I am really fortunate to be an associate professor in the Department of First Nations Studies at UNBC. I do have a short slide deck that I put together just to more keep me on track than anything else. But I was asked to come and share some of my more recent research that's been related to Indigenous peoples living with multiple sclerosis. And this has been a huge privilege for me to be involved in this research and share part of my stories at UNBC, but also beyond. I've had an incredible uptake and interest in this study and the research I was able to pursue. So I'm just going to share my screen. Hopefully this comes through just fine. I'm hoping you can all see it now. I was awarded a small grant from the BC Network Environment for Indigenous Health Research a couple of years ago. And part of that grant that came forward was an invitation to consider applying for some additional funds related to patient partner engagement. And this is what leads me to the title of what is in front of you this morning, because I am a patient. So I was really struggling with the language and the terminology and how the funding itself was encased around this particular perspective about who the type of academic should be leading studies and who is considered the patient, who is considered the researcher, where those power relationships exist. But after I spent time and did some more consultation amongst people at the BC Support Unit and also with the BC Network Environment for Indigenous Health Research, I was really grateful to take the opportunity to consider my study as more of a patient-partnered, a very collaborative and shared experience between myself and what I would normally, as a social scientist, call my research participants. So changing that language to patient partner has been a bit of a change for me as an academic, but it's a welcome change in my life and in my trajectory of how I'm moving forward. So like I said, I'm an associate professor in the Department of First Nation Studies at UNBC. I'm also a co-lead for the Indigenous stream for the Canadian Institute for Inclusion and Citizenship at the University of British Columbia. And I'm really grateful for the opportunity to work with the amazing scholars at UBC who are really helping uphold and highlight and celebrate my work that's really grounded and invested in understanding more about the traditional knowledges and contemporary experiences for Indigenous peoples living with disability. And myself, as a scholar that lives with chronic illness, I was diagnosed with multiple sclerosis in 1997, and I do live with significant disability due to the progression of the disease and the accumulation of the disease impacts. So this has been, like I mentioned, a whole new trajectory for my own learning in research, but also just learning about how I'm navigating these academic spaces and finding that really important niche of lived experience that's being acknowledged and being translated in a genuine and authentic way. So I was just mentioning before we started the call, I never don't underestimate the privilege I have to be an academic, to be a researcher, and to be moving this kind of work forward. And this study is absolutely no different. So as I mentioned, I'm from northern BC. I grew up in Smithers, BC. My mother was adopted out in 1953 during the era of the 60s scoop in Manitoba. And so she grew up very far away from her traditional territories. And as a result, so did I. But that focus has always been something that I hold and uphold as a central and defining part of my work as an Indigenous woman, as a scholar, and finding spaces and opportunities to be amplifying knowledges that, again, aren't otherwise well represented. So really quickly, I don't have a lot of time, but I'm going to give you a sense of the background and my research objectives, the methodology that was chosen for this study, and the challenges, opportunities, and the role of culture as part of a continuum of care for those living with multiple sclerosis. And that really, really important tenet of learning from patient partners is something that I feel academia needs to be doing more boldly and very intentionally in ways that are not always well represented. So for those of you that don't know, multiple sclerosis is a chronic autoimmune disease that affects the central nervous system. And so it affects the brain and the spinal cord. And although it's different for every individual that lives with MS, there's variations and there's a spectrum of how people are impacted by the disease. I live with although I was diagnosed with what's called relapsing remitting MS, I now live with what's called secondary progressive MS. So I'm on a trajectory where my accumulation of disease impacts will only worsen and become more pronounced and profound in my day-to-day interactions with the world and how I'm moving through this very ableist system that we exist within in academia, but just generally in society. And one thing I've noticed, and I noticed from the very, very beginning, is that Indigenous perspectives on multiple sclerosis are extraordinarily underrepresented. When I was first diagnosed, a healthcare provider told me that this disease is coming from your European ancestry. And it was something that I didn't believe, and I still don't believe, because I know lots of people, Indigenous people, that are living with MS. And so when I contemplate the absence of that acknowledgement, how that impacts people's perceptions of disease, how diseases can become racialized, and how they may have become racialized from my experience, it's something I feel really strongly that needs to be acknowledged and understood. I'm a social scientist, so qualitative research is at the forefront of my work, and I'm an Indigenous scholar. So my study was really grounded in Indigenous theory, and it was an opportunity to learn the stories and engagement with the patient partners to understand the social, cultural, and spiritual factors that are influencing their multiple sclerosis journey for Indigenous peoples, their families, and communities. So I really feel strongly the study seeks to foreground Indigenous perspectives on MS research and promote culturally relevant healthcare. So really, I adopted a storytelling methodology. It's something I've done in my doctoral work and in several studies since then, because I really feel that stories they epitomize decolonization, and they really do very boldly entrench indigenization within academic research. The Indigenous and university ethics experiences I went through this study were really important. So this included receiving support from Lheidli T'enneh Nation and also the University Research Ethics Board. This is something that I really strongly believe that we need to always ensure that we're acknowledging and abiding by research ethics expectations and protocols on the territories of the nations that we are working within, and especially for those that are from these nations. So these semi-structured interviews really did encapsulate 5 patient partner stories for rich and meaningful data. And this collaboration was continued throughout the writing process. We've had several follow-up engagements since the study was completed. This includes having an entire engagement with the physiotherapy and occupational therapy students at UNBC. I more recently presented alongside the patient partners and the student co-authors that helped with my peer review publication for the Health Research Institute speaker series at UNBC. And then we were invited to speak on a local radio program about the study. So this is a strong example of how this patient partner research really does offer a whole new opportunity to hear people's lived experiences through their authentic voices. So we really, and I say we because this was done collaboratively, the diagnosis story of each patient emerged to have extraordinary value throughout the duration of disease experience, because there was diverse preference of MS treatments, and this included Indigenous healing practices alongside Western medicine. This is really, really important to me and really important to the patient partners that this is acknowledged. We also talked a lot about the availability of support services and the northern realities that exist for us here in northern BC. I may have stayed in Smithers if things were different. I might not be living in Prince George, but there's such limited resources. We also talked about having more mobility available for diagnostic equipment and treatments. For example, having an MRI machine, being able to go to remote communities would be extremely, extremely valued. The peer-to-peer activities were also something that were highlighted amongst the patient partners, and we can't understate the importance of community and how that moves through our entire domain of living with MS. So these themes really did for me show how the continuum of care for us, although individualized, did have these threads of similarities and differences that need to be acknowledged, so that we can curtail treatments and supports and services appropriately and in ways that are accessible, equitable, and diverse, so that we're not all perceived as having to be fitting into a particular mold of care. I really feel I am continuing on a strong learning journey. And this is something about myself. I mean, I've lived with MS for 30 years. So it's been a huge part of my life. And I have lots more to write about it. I want to do lots more research in this area. And I'm very excited. And just a little add-on is the pictures that were included. These drawings here are from a children's book that I published. Actually, it just got picked up by a publisher officially in 2025. So about MS, disability, and the Métis sash. So it's a story about my conversation between my niece and I about living with my disease and how that affects her as well. So I want to thank you very much for your time.
Thank you, Rheanna. Hi, everyone. I am the session moderator. I just want to apologize. The tech host would not let me in to this session, so I'm sure the speakers are wondering where the heck I was. So thank you so much, Rheanna, for just going ahead and presenting. I just want to say
Nice to see you. It's nice to see you,
it's good to
Leana.
see you as well. I'd requested this session, so I think a lot of messages going on behind the scenes asking why I wasn't allowed in. So I just wanted to say really quickly, each research project has 30 minutes to present, and because we started 15 minutes late, if everybody is okay, I'm fine extending the session until 11:15, as there is a health break from 11 to 11:30. And I should clarify, 15 minutes present and 15 minutes for questions. So I'm going to open the floor now to questions for Dr. Rheanna Robinson's amazing presentation. Oh, I am on somebody else's computer. Thanks, Erica. So there was added confusion in that. I'm down at the Putting Patients First conference in Vancouver, and I'm just being thrust into somebody's hotel room and stuck on their computer. So.
If there aren't any questions, I might just add a little bit. Oh, there's a question. Okay.
Sorry, I was just going to ask a question. I was going to say thank you very much for the presentation. I think as always, it's very thoughtful, and it draws in the ways in which we can then think about applied research and how your experiences and the ways in which you've gathered and generated, what you've come to understand. How would you see this moving forward in the ways that we could work with health systems to bring about change? I heard you speak to, wouldn't it be lovely if we had a mobile MRI?
Mhm.
And just, as you step forward in this journey, what kind of levers do you need to pull, or mechanisms do we need to see happening in ways that you think that there could be a translational piece here to shift the healthcare system in any way?
So although this didn't come up like really prominently in this particular study, the whole the impact of a stigma, assumptions, and the stereotypes that go along with chronic illness is profound. Because even though, like for me, I live with physical disability as a result of chronic illness, there's still this huge hesitancy for people to become engaged and more open about their experiences because of the fear of disclosure and the fear of those stereotypes that don't just come from our day-to-day activities. They are embedded within the healthcare system very, very fiercely and profoundly. It's part of our educational realities as we're getting trained in these programs for service delivery. And we need to be finding ways and opportunities to be calling out the impacts of these systems. My disability-related research really focuses on the connection between ableism and colonialism in Canada and in North America. And I stand by the reality that one would not have happened without the other. And, Indigenous peoples were significantly more impacted by chronic illness, significantly more impacted by disability. And as I live in the North, where breakneck modern industrialization is only going to invite more of this and increase these disparities more profoundly. And with healthcare systems that are just not well positioned to respond to that, just by way of this long history of an educational, a forefront of education that has just not prioritized these areas. So again, I go back to why I really fundamentally believe it's going to be through stories, and it's going to be through creating safe spaces that are genuinely honoring the lived experiences and the voices in a way that's equitable and valued. And we can start infusing some of those values into the system overall.
Rheanna, we do have a question in the chat. Would you like me to read it out?
Sure, that'd be great. Thanks,
Okay.
Leana.
Thank you for your presentation and sharing your story. Has it been challenging to find patient partners willing to share their stories and experiences, particularly with the historical and ongoing impact of health systems for Indigenous peoples? If so, how have you been addressing these challenges?
It's absolutely challenging. Again, I go back to that reality of the assumptions and the stereotypes and the fear that goes through disclosure. I can say from my own experience, anyone at UNBC that's known me for a long time will know that for more than 20 years, I did not tell a single soul I lived with multiple sclerosis. It was a deep guarded secret, and the weight of that burden was tremendous for me. So I know those realities, and I know that fear, that disclosure is extreme. And then to put on top of that just the inadequacy of the supports and the systems in place to make sure that people are going to be okay. So yeah, recruitment was, because I've lived here for long enough in Prince George now. I know people. I'm involved in the MS community in Prince George. I'm involved in the MS community nationally. I'm a director for MS Canada, so I do know different pockets of people that are in a position that they want to talk. And I understand why they don't, because if somebody had have invited me to this same study 10 years ago, I would have declined the invitation. So these are realities, and I also know very, very, very well the discrimination, the racism Indigenous peoples are already experiencing on a day-to-day, the added burden of chronic illness, disability, and identifying in those spaces as well is, like I said, it's a significant burden, and it can be extremely challenging. But I always remain hopeful because I always remain very close to knowing that some of this research that I am really trying to amplify related to Indigenous experiences of disability is going to start to have an influence and a change on these perceptions and these understandings, and then in how people are feeling more safe and comfortable in these spaces.
Is there anybody else in the audience who had a question? Well, I might jump in and ask because I've been lucky to be able to see this project as it went along. And you mentioned that I know you wrote that amazing kids book.
Yeah.
And you said you got a publisher for it. Well,
Yeah.
congratulations. Where would we be able to find that?
So if you go on the Strong Nations website, that's the book distributor's website, you can order it there, but it's Wave Maker Press that actually is the publisher for it. And they're all sitting in they're all actually on my kitchen counter. They're not right here, but I could show it to you. But it's just a little, and they're inexpensive. But it really, for me, it was about being able to articulate and tell a story for children, because I really intimately understand how much my living with MS does not just affect me, it affects my family, it affects the communities I'm from, and people have questions. People also have a very significant fear of disability. And this is a reality that needs to be acknowledged. And I really felt that having a children's story would help to dispel some of that for my niece. And it all came because she was visiting me. And at the time, I was still only using the walls to hang on to myself when I was going down a hall. And she's like, why do you walk like that? It was this very genuine, she just was very curious. And then when I told her, I said, I have MS, she really had a very strong look of fear about what that meant. It just created this whole space that she was, she was worried for me and she didn't understand. And so I use the story and I use the Métis sash to talk about inclusivity, to talk about diversity, and just to talk about MS more generally and disability. Oh, so I see I saw that one question come up.
Thank you, Rheanna. I know that just back to your point about how storytelling is an amazing way to describe something rather than a full-on academic journal. I think that the children's story reaches so many people because I know a lot of people without children pick it up too at your presentations.
That's great. Thanks, Leana. Thank you. So I see a question here about the defaulting from the professional academic experience. So, I will say that this is where the gift of me being a trained Indigenous scholar has been, sorry, I should repeat this question. It's about sort of, separating the personal experience from the professional. I've been trained since I started, I started university in 1995 when UMBC first opened, and I was trained to integrate my personal experience. So I've always struggled with not being able to integrate it and not being able to honor it for being of extraordinary value. And although academia is still not ready to accept it, I know that this is part of it's another huge opening and opportunity Indigenous peoples have been able to gift to the academic world, is seeing how those realities are really, they're part of who we are. They're part of my human condition and all of that it brings. And so now that I have tenure and I'm here at UMBC and I can talk about this openly without fear, I am grateful that I can do so. So my professional and academic realities are entirely intertwined and entirely relevant to each other. And I don't think it would be as meaningful to me if it wasn't.
Were there any other questions? Okay. Okay, well, I'd just like everybody to, again, thank Dr. Rheanna Robinson for her wonderful presentation. Thank you.
Thanks, Leana. Thanks everyone for being here. I really appreciate it.